Well, we are halfway through our latest COVID restrictions that, among other things, forced health clubs to shut their doors again. But club owners have been lobbying state leaders and offering suggestions on what they can do to make sure they can reopen on December 18th. Lou Raguse has that story.
This is incredibly painful.
From the moment Governor Tim Walz announced gyms and health clubs would have to temporarily reclose, Lifetime CEO Bahram Akradi has publicly led the opposition to that decision.
I don't disagree that the problem exists. The solution was not right.
Saying that among the 21.5 million member visits to Lifetime clubs, they've only had 962 reported COVID-19 cases.
The clubs are probably the #1 place in the United States today for contact tracing.
Now, Akradi is among many other health club and gym CEOs and owners trying to work with the state on additional safety measures to be allowed to reopen. If Governor Walz extends his 4-week pause set to expire December 18th, the health club community is hoping it won't include a total closure of places people exercise. Lifetime has suggested they could impose advanced registration before guests come, a mask mandate at all times, further reducing club capacity and adding more social distancing requirements. Akradi says other states have restrictions like those, but Minnesota and Washington are the only states to currently force gyms to completely close.
People need physical activity.
State officials defend the governor's decision based on their data. In a statement, the Minnesota Health Department says for cases for which we know the likely sources of exposure, gyms are among the social settings with the most outbreaks and cases attributed to them. Lou Raguse, KARE 11 News.